This is about how to do search engine optimization for healthcare businesses. First, I'm going to give best practices for healthcare businesses, but these best practices will also be applicable if you have a services business or a local services business. These healthcare SEO best practices will also be applicable to you. Then I'm going to get into the compliance stuff, specifically HIPAA compliance, sharing SEO best practices around that. The tips that I'm sharing in this episode of the podcast, in my daily digital marketing podcast, is episode 698 of the show, 698 days in a row doing this podcast. The tips that I'm sharing, they're from the search engine optimization subreddit on a post about doing SEO for healthcare. And I'm sharing my favorite tips from this post. This post got a lot of comments, and I read through the comments and I cherry picked out the best ones for you. Some of these tips, they really were fire. The post is, got hired to fix the online presence of a small medical practice. Where the hell do I start? This person said, so I recently took on a freelance gig for a family-run clinic, general plus derm plus allergy. They've been around forever, have loyal patients, great doctors, and a website straight out of 2010. Their SEO is basically non-existent. No structured content, no review strategy, no idea what local rankings are, no tracking, and nothing. I'm not new to digital marketing, but healthcare SEO is clearly a different beast. Between HIPAA, sensitive topics, and how people search for care, I don't want to just throw generic tactics at this. I've been trying to learn, 1, what actually works for getting clinics ranked in local search. 2, is there such a thing as SEO that respects medical accuracy plus patient trust? And 3, any tools or case studies you'd recommend. So that's the post, and these are the best comments, the best tips in this post. And the first one's kind of a joke. First one is, site straight out of 2010. I hope the first step in your strategy is the total site redesign, because who cares if you increase their traffic if it doesn't convert? And that's true. It's just something that a lot of people need to keep in mind. Having a nice looking site is actually very important. You want a nice site to help with user experience, to convert people. But I'll tell you this next tip, I thought this next tip was so good. So this next tip is Google My Business Profile, links to specific service pages, website that literally follows basic SEO principles. You don't need to rank in a 100-mile radius, just 15-ish miles. You don't need tons of content. This should be a 3 to 6 month deal, and the rest is on autopilot. So somebody asked, what do you mean links to service pages? And this is where it was so good. You can link products in the Google My Business Profile to pages on the website. I put the major services that I offer as products and then link those to the respective service page on my website. So in Google Business Profile, when you list your products, you have the URL, and that URL goes to all the services that you offer, and you have a page on your site for each service that you offer. And those services also rank on Google. And I'm going to talk about that a little bit with another comment that somebody left. Super relevant, really amazing. Oh, if you want to learn how to do these SEO services pages, how to make them the best for Google and AI and various search engines, I show exactly how to do that in my SEO course, Compact Keywords at compactkeywords.com. And then you have these services pages, and they're in a services hub page for everything that you offer, for all the medical services that you offer. And again, this is relevant to any services industry. You have a Google My Business Profile, you link each product to a service page on your site. You have all your products there on Google My Business Profile. You also link it to the service pages on your site, and you house those services in a services hub page. It's just yoursite.com/services, and then the URL structure follows the same thing. /services, /the service that you offer. And then you make a page for each service. Such good advice. I really like that. Next comment, and this was just a straight list of great practices. Oh, I want to give a disclaimer actually before I go a bit deeper. So the disclaimer for this, because of the nature of this niche, the disclaimer is the information that I'm just going to read the disclaimer that I've written. The information shared in this podcast is for general informational purposes only and is not intended as legal advice. Please consult with a qualified professional for any legal or compliance matters related to your healthcare practice. That's the disclaimer. Next comment, this one was really good. Healthcare is really straightforward. Here is what you need. Update your location pages first. Make sure you have all the basics of what it is and what it does. Of course, list what you treat at every location and what doctor is where. Make sure every doctor has a page or profile with some details about who they are, what they focus on, locations they are at, maybe even a short video that shows their human side. That's great advice. On the web end, you are going to structure your website into two main groups, conditions and treatments. Conditions go into what it is, what to know about it, treatment options, and most importantly, common questions that patients ask. Treatments, you are going to do the exact same thing, except for treatment options, put what patients can generally expect. So you could include those treatments in your services pages. Make sure to interlink the setup for all of these doctors who handle those conditions, link them on those pages, locations who handle those conditions, link them on those pages, conditions who are handled at certain locations, link them. So you have a location, the location links to the conditions, but the conditions also link back to the locations. Everything is linked so people know what is where. Build pages for appointment scheduling so they can rank for those searches as well. I like that advice. It's a bit complex, and the problem with advice like that is you're going to have to do a lot of updating. Things will change, doctors come and go, all of that stuff. So what I would recommend when doing stuff like that is think about how you can scale it and how you can make it dynamic for when doctors go or you offer new things. That is something that a lot of SEOs don't think about, a lot of digital marketers don't think about. It's making a site that can scale with your business or that can easily change when your business changes. That's just worth keeping in mind. This next comment, this is another good one. This person said, all of the comments here, good advice. And actually, I worked in healthcare for 4 to 5 years, and we did most of the stuff in these comments to go from 90,000 to 500,000 monthly page views. I would just add, after you build a doctor profile for each physician, quote a doctor in each piece of content you make and link it back to their profile page to increase EAT on that page, along with the ability to book appointments for them. Oh, and allow people to book appointments on their physician profiles too. And if you don't know what EAT stands for, it's a very important acronym in SEO. It stands for experience, expertise, authoritativeness, and trustworthiness. And it's really applicable to things like healthcare, things like finance, things that have to do with YMYL, which stands for your money, your life. Super relevant. The commenter who said healthcare is really straightforward, here's what you need. This commenter followed up and said, one additional item on booking appointments I learned was don't try to guess how a patient wants to do that. Give them multiple options and meet them where they want to be met. Access and convenience are the biggest factors, and everyone wants to do that differently depending on the generation. Somebody else said, yeah, put everything, a call button, the phone number in plain text, a form, anything you can think of. Younger generations are going to be able to figure out where the contact page is or figure out how to get there with Google Maps and all this stuff. Older generations, they're going to have more trouble. And especially in a niche like healthcare, that is something completely worth thinking about. But it's just something completely worth thinking about for any business, products or services. People don't want to have to think. And if you want people to give you their money, you should make it as easy as possible for people to contact you or to buy. SEO Pub said that SEO Pub is a top commenter on the search engine optimization subreddit. I've shared SEO Pub's insights before on this podcast. SEO Pub said, what actually works for getting clinics ranked in local search? The same things that works for non-clinics. Is there such a thing as SEO that respects medical accuracy plus patient trust? Of course. What in the world did you have in mind that would ignore medical accuracy and infringe on patient trust? But I like this first part, is that the same thing that works for non-clinics works really well for clinics. So again, if you are a services business, everything that I previously mentioned will be directly applicable to you. I loved this comment. This person said, I was head of SEO for the largest hospital network in the US. The SEO process is the same. For you, it's easier because you are only doing one local business. If the site needs to be redesigned, then do it on a dev server and make a copy of the current site and build it out properly. Healthcare is heavy on the content side. It's a lot of work and you have to make sure everything that is written is approved by a healthcare professional because everything has to be 100% accurate. And the last comment that I want to share, I really like this one. This commenter said, had to deal with this for a pain clinic that had 0 local rankings despite being around for 10 plus years. What helped us the most was rewriting location pages to reflect how people actually search. Symptoms are more important than services. So an idea is people put their symptoms into search, and you have a page that targets that symptom and says, we help that symptom directly. Here is how we do it. And that actually is kind of like a service that you offer. You could even put the symptom and then add the word services after. But you should, of course, have services pages as well, because people will search for the services too. Services are keywords, symptoms are keywords, but symptoms, and this is kind of a bad thing to say, but it's true, symptoms are going to convert a lot better because people want to alleviate their symptoms. And that's the same thing with any niche. People have a problem. They put their problem into Google to get a solution. You offer a solution and then help people use your product or service as a solution. Back to this comment, giving each doctor a profile with areas of focus plus patient-friendly content. Every other commenter said that. So if you have a healthcare business, you should do that. And then grouping site structure around conditions and treatments like others have mentioned. Those are all of the tips that are applicable to any services business. Now I'm going to get into the HIPAA compliance stuff. If you don't know what HIPAA is, it's standards for protecting sensitive patient data, also ensuring the privacy of individually identifiable health information. There's a lot of rules around HIPAA, so I would encourage you to research it yourself. But I liked these comments from this thread, from this post, on how HIPAA applies to SEO for healthcare businesses. First one, very short. For trust, have doctors review content for accuracy, FAQs, and what to expect. Posts are great. Avoid patient specifics, which is HIPAA. And somebody else said that. Somebody also said, have doctors review the content for accuracy. Somebody else said, we brought in Fortress growth after hitting walls with generic SEO agencies. They actually understood HIPAA and patient trust stuff and helped us dial in local plus medical specific SEO without bloating the site. And the last one, it was pretty long, but if you're interested in HIPAA, it's worth hearing. This person said, hi, I work in-house at a large healthcare company, and despite some of the comments, I think you're being really smart to take a moment to consider the differences in healthcare and the implications. I agree with the suggestions to audit the site content and structure. Be very careful with conditions and treatments content. Inaccurate medical info is a huge liability. Of course, you have to say what you offer, but handle with care and don't get too clinical. Avoid making promises on outcomes or claims of being the best. Consider a legal review before publishing anything clinical or service related. I like that tip. Avoid giving claims on being the best. I actually think that's a good tip for any product or service. The reason for that is because if you yourself say about your own business that you're the best, a lot of people aren't really going to believe that. And it doesn't really help you. You instead should say, this is what we do. And you say it in an authoritative tone. And you say, we really care about this. Here's examples of how we really care. That's a lot better than saying we're the best. So back to this comment, Google My Business profiles and reviews work well for local SEO. Make sure it links to an optimized location page or physician profile page as appropriate. Is yours claimed and verified? For a small practice seeking visibility, it would be best to try to funnel patient reviews towards a single clinic location profile, Google My Business, versus individual physician profiles, at least initially. But if the MDs have big egos, this is easier said than done. For HIPAA, first-party data is key. There are other ways around this, but they're expensive. For a small practice with nothing, favor basic in-house analytics over Google Analytics. Free, quote-unquote, free Google products on your website are not HIPAA compliant. Don't integrate any third-party tools from vendors who collect data and won't sign a BAA. Godspeed, and then edit it to add. You also need a formal process for responding to reviews. It's another potential HIPAA compliance pitfall. For example, they can't even confirm that they saw the patient, even if the patient chooses to share great detail about the care they received. And those are my favorite comments from this post, from this thread on the SEO subreddit about how to do search engine optimization for healthcare. If you are a healthcare business, I hope you found this helpful. Or just a general services business, I also hope you found this helpful. If you want to go deeper into SEO, especially a course that shows how to do SEO that actually gets customers, that gets leads, that gets people to call you and make appointments, my course, Compact Keywords, 13+ hour course on exactly how to do this step by step, shows you how to set up these service pages, shows you how to structure your site, how to do information architecture, how to do a site audit, how to find keywords, all of this stuff. That's at compactkeywords.com. And this is episode 698 of my daily digital marketing show, The Edward Show, 698 days in a row doing this podcast. Thank you so much for watching. If you listened on Spotify or Apple Podcasts, thank you so much for listening. And I will talk to you again every day. Do this thing every day. I will talk to you again tomorrow. Bye now.